Hi, my name is Sophie Powell, and I will be presenting a presentation about Achilles tendonitis. Achilles tendonitis is an injury that causes inflammation in the Achilles. This tendon is really important for movement like walking, running, and jumping. This is when the calf muscle connects to the heel bone is where Achilles tendonitis can form. This injury is really common in athletes and especially runners because of the repeated stress on the tendon over time that running can cause. My patient is a 20-year-old female, and I'll be going by her initials BLB to keep her information confidential. Because of her activity level, she's at higher risk for overuse injuries like this. For her diagnosis, she was diagnosed with Achilles tendonitis. This condition is commonly caused by overuse, which is especially in athletes or runners. Since the Achilles tendon is used a lot during activities like running, it can become irritated or inflamed over time. Other factors can contribute, including tight calf muscles, improper footwear, or increasing activity too quickly without proper conditioning. In my patient, BLB, in her case, she got Achilles tendonitis because she's a runner, she's an endurance cross-country runner, and for her mileage, she's trying to build up to 40 miles per week, and she was at 30 miles per week for a few weeks, and she jumped to 40, so it was a 10-mile difference, and so that definitely caused her Achilles tendonitis. I think with runners, you need to only increase about 5 miles or less to prevent injuries. So her symptoms, the main symptom she experiences was sharp pain in the back of her left heel. The pain got worse when pressure was applied and during activities like running and even walking. She also had some stiffness, and especially after activities or when she first started getting back into running and movement. This is common because the tendon tightens when it hasn't been used, and then the potential pain is whenever movement begins. For treatment, she used both medical care and physical therapy. In physical therapy, she worked on strengthening and exercises for her ankle, her calf, and quadriceps. This helps support the tendon and reduce the stress on it. She also likely did stretching activities to improve flexibility. This is especially in the calf muscles. Some common exercises for this includes calf raises, some resistant band exercises, and just stretching the Achilles tendon. These exercises help rebuild strength and improve movement. On the medical side, she received PRP injections, and this stands for platelet-rich plasma. And so these injections are whenever they take blood from the patient, and then they do a process to concentrate the platelets, and then they inject it into the injured area. And so this just promotes healing and a quicker healing process when needed, and additional support is needed. And because my patient BLB is a cross-country runner and she was in season and she needs to get back into her season as soon as she can, this process helped her try to get back in season whenever she could. So for her prognosis, her outcome was very positive. She completed about 12 weeks of physical therapy, and she went twice a week along with her medical part of the PRP. Her pain gradually decreased and her strength and mobility improved. After finishing therapy, she was able to return to cross country, which was her ultimate goal, and now she has little to no pain and she's running. She's back running. Of course, when she's running, she has to really take it careful to prevent getting injured again. She still is continually doing her exercises to make sure that all those muscles are staying strengthened, but also she is making sure she's starting off slow and doing walk running and on and off minutes, and she's not running every single day. She's still cross training to just slowly build her back up to where she can run again, because this injury can come back really easily if not taken care of. So how PT helps. Physical therapy plays a big role in recovery Achilles tendonitis. It helps increase in the ankle, strengthen the ankle, surrounding muscles, which takes pressure off of the tendon. It also improves flexibility, range of motion, and which helps the tendon move more efficiency without irritation. Another important part is injury prevention, which is the most important part actually. Physical therapy can help correct movement patterns and build endurance, which lowers the chance of the injury coming back. In conclusion, this case shows how effective medical treatment and physical therapy can be together. Achilles tendonitis, for treating Achilles tendonitis. With the right care and consistency, patients can return to their normal activities after doing treatment. And even 12 weeks, that's really it. I mean, it's a long time, but if it's not treated, it's not going to go away. It's going to keep bugging you. And so she did good by following her plan, and she knew how important her treatment was going to be and staying consistent with therapy, and she went and stuck to it, and now she's healed and she's back running. So that is my presentation. Thank you so much for listening. Have a great day.